one of the reasons why I thought this would be a good topic, I think it came up during one of our discussions, but one of the reasons why I thought this would be a good topic to talk about is because it'll give us a vocabulary, because there's a lot of ambiguity around terms, how you speak of things. Like you just mentioned there, Ron, about dying with dignity, what that means, um, like what's ordinary care, what it means to be actively dying, all of those things, right? So hopefully by the time we get through with this, um, we'll be able to have a sort of a solid vocabulary to enter into the dialogue, especially in those moments. So my grandfather passed away last Tuesday, and so some of this is a little bit fresh in our minds. It's amazing how you have to defend things, right? And so both of my parents also passed away, and both of them sort of at end of life stuff that we had to make decisions, but in each case there was also like a kind of a force pushing the other way to kind of expedite the situation. So it was good to be able to navigate this, and it tends to be at least 3 out of the 3 times that I've had to deal with it directly, tends to be once you sort of show them you know what you're talking about, they kind of back away. We did get a little push um, with my dad. I got a little bit of pushback, but the pushback was a poem about dying with dignity. That was the extent of their pushback. Um, but nevertheless, it helped to sort of have the necessary vocabulary to talk about it. So at least foundationally, let's talk about dignity, what the church means by this. Yes. Um, yeah, I mean, I think they would say that like it wouldn't be that they would try to kill it, like they wouldn't put it that bluntly. No, I think they're trying to sort of put an end to the suffering, right? That's what they would say. It, like with my dad, it was kind of them pushing back on him getting nutrition and hydration, and they sort of try to guilt you into thinking you're prolonging their life. Um, but then I also told them that they prolong their life by eating lunch, so they shouldn't eat for the rest of the month and stop prolonging their life, and they sort of just backed off, right? So, and that's when I got the poem, which worked out great. But the point is, like, sometimes you have to push back a little bit. Sometimes it helps to be a smartass about it too, um, because then they just don't want to deal with you. But no, I don't think it's just active. Like, I mean, most people are like people of goodwill, just don't think about it, and they're just like, well, why would you needlessly prolong this to make somebody suffer more, right? Um, yeah, there is, but I think the average person walking around, the average person you're going to deal with in a hospital, the average like hospice nurse, no, a director, maybe. So you have to be careful. I mean, a hospice, um, again, just sort of anecdotally, um, really good at taking care of people, but you have to give them very strict parameters in which to work through, in my experience. Okay, so sort of goes without saying. So let's talk about dignity, because there's a key piece of this that often gets lost, right? Because we talk about dying with dignity, what that actually means. So the dignity of a person must be recognized in every human being from conception to natural death. This fundamental principle expresses a great yes to human life and must be at the center of ethical reflection on biomedical research, which has an ever greater importance in today's world. Okay, so again, sort of obvious, but what does it mean when we say that dignity must be recognized, which is what um, Dignitatis Personae is saying here? It must be recognized. So what does that mean? So let's talk about dignity. It tends to be immediately when we talk about dignity, we talk about the dignity that comes to us being made in the image and likeness of God, which is true. But there's also a second dimension that we ignore. Okay, so what the church would call an ontological dignity, so dignity that we cannot lose, is the fact that we are made in the image and likeness of God. But because man has the capacity for freedom and self-determination, he can either increase in dignity or decrease in dignity, right? And so, in a certain sense, true dignity lies not just being made in the image and likeness of God, but conforming yourself to the God-man Christ, and becoming a man or a woman of virtue, right? Um, and this becomes a really important piece to emphasize, because how do we often grow in virtue? Through suffering, right? And so, what it means to walk with someone who is dying and dying with dignity, first and foremost, what it means is that somehow um, they still benefit from it, right? So that they still grow in virtue, um, and even on a supernatural level, so that it becomes a sort of a worthy offering that they can give to God, right? Because the last thing that we have to offer God is our death, right? And so a lot of what we need to do as Catholics is to help people to die well, and in a certain sense, the meaning of life is to die well, right? And so we have to always remember that the dignity also resides in the fact that a man or a woman is virtuous, and so in a lot of ways, God has ordained that death is meant to perfect us, right? Um, and He has sort of handpicked, from all eternity, He has handpicked the death that we will have. And so we can not only make an offering to it, but in a certain sense, it is for our benefit as well, right? And for our sanctification and perfection, both on a supernatural level and a natural level. Does that make sense? Okay. So this has to be like the focus, right? So thanks be to God, just having gone through this with my grandfather, that was our focus. Our focus was dying well, and lifting him up in times when he was just like, he was 101, so he was done. But just knowing at times that our goal is to lift him up so that he courageously faces what's coming before him, and is ready for it, right? Is ready for it. So it tends to be then the emphasis does not go on what I'll call a quality of death or dying well, but a quality of life. And this tends to be the sort of overall, if you sort of were to try to encapsulate what the ethic of life is, it would be based upon this principle of life worthy of life, that has these sort of three aspects to it. So the first one is sort of obvious. Is it wanted? Okay, so the world would say that a person who is not wanted, so be it a person in the womb or a person at the end of their life, person is no longer wanted, is not worthy of life. Okay, has no quality of life. Is it in too much pain? That one again, pain is the only evil, and so we must do everything we can to eliminate it in the name of compassion. But very often, that question is, in a certain sense, narcissistic, because people want to end pain because it's uncomfortable for them to watch someone else go through pain, right? And so even that's a little bit self-serving. And then, is it severely handicapped, right? And so again, we see this within the womb, and as the person approaches the tomb, especially when we talk about people that are in a vegetative state, which we'll talk about in a little while. Second, the spirit of the world also tells us that happiness can only be found in a lack of suffering. So Pope Benedict says, today what people have in view is eliminating suffering from the world. For the individual, that means avoiding pain and suffering in whatever way. Yet we also see that it is in this very way that the world becomes very hard and very cold. Pain is part of being human. Anyone who really wanted to get rid of suffering would have to get rid of love, because anything else, before anything else, because there can be no love without suffering, because it always demands an element of self-sacrifice. Because given temperamental differences and the drama of situations, it will always bring with it renunciation and pain. Okay, and so the point that the Pope Benedict's making here is that Christians ought to be able to help people find meaning in their final sufferings. We ought to be able to talk to someone who's going through that and help them to find the meaning in their suffering. And again, going back to the fact that in a certain sense, like suffering naturally perfects our virtue. What kind of virtue? Yeah, I mean, so patience, courage, like really all of the ones like that are related to fortitude. I mean, there can obviously be other ones too. There can, but in general, it's usually patience, courage, long suffering, in both the persons like directly suffering and their family members. Just a reminder, sort of, why we even care would be what John Paul II calls the sanctity of life ethic. And his point was that human life is sacred because of its beginning, its nature, and its end. Human life is sacred because from its beginning it involves the creative action of God, and it remains forever in a special relationship with the Creator, who is its sole end. God alone is the Lord of life from its beginning until its end. No one can, under any circumstance, claim for himself the right directly to destroy an innocent human being. This again goes to that this sort of radical freedom, which just sort of sits at the heart of euthanasia, that says that I am the master of my own life, right? That life in and of itself is not a gift from God, but instead I get to decide and live on my own terms, right? And ultimately it's God who gives us life. And in accord with that, we have to also let him choose how our lives end and not take it into our own hands. Here is sort of to go back to my point earlier about how we don't like watching other people suffer. And very often we'll put an end to someone's suffering simply because it makes us uncomfortable. John Paul II talks about that. So in such a context, suffering, an inescapable burden of human existence, but also a factor of possible personal growth, is censored, rejected as useless, indeed opposed as an evil, always and in every way to be avoided. When it cannot be avoided, and the prospect of even some future well-being vanishes, then life appears to have lost all meaning, and the temptation grows in man to claim the right to suppress it. Right, and so we are extremely uncomfortable with suffering. All right, so all of that is sort of foundational principles. Any questions on that before we go into the more practical side of this? Would I argue that the death penalty is okay? I would absolutely argue that the death penalty can be used. Why? Well, because punishment is a good thing, right? Like, and because there are well, the first answer to the question is because God said so in Genesis 9:6. But this, my own personal sort of why it is right is because justice is also a good thing. Yes. Justice is good for both the person, like society, and the person who has committed the crime. Yeah, well, that's So Genesis 9:6 says exactly that, right? It says because of the dignity of man, anyone who takes man shall he be killed, right? So that's the whole point, right? Like you can't, the point about dignity becomes like a double-edged sword, right? Um, like human life is so valuable that if you take it, you can, in certain circumstances, forfeit your own. All right, any other questions? Okay, so first thing I want to talk about is, which seems to be one of the more common things, is what about pain medicine? Okay. Um, and so the sort of overarching moral principle is the principle of double effect, which we've talked about before, but just kind of by way of reminder. Um, it is morally allowable to perform an act that has at least two effects, provided all four of the following conditions are met. The objective act to be done must be good in and of itself, or at least morally indifferent. The intent of the agent must be to achieve the good effect and to avoid the evil effect as much as possible. The good effect is proportional to the bad effect. The good effect must follow directly from the action and not as a result of the harmful effect. Okay. So again, just by way of clarification, so the second point is essentially the evil must not be directly willed, but it may be permitted, right? And even if the effect is foreseen, okay? So what this means is that we might know, for example, that a particular treatment may hasten the death of the person, okay? And despite knowing that, we can still administer it to them, provided, one, that it is, let's take pain medicine as an example, right? That the amount given is proportional to the amount of pain they're in, okay? It is always good to relieve pain in people. Now, on the flip side of that, the person dying may refuse it, right? And again, there's sort of no problem with that from a moral standpoint, right? But from somebody ministering to that person, you should always, in any moral way you can, limit the amount of pain the person is in, right? But to give them pain medicine, you should only give the amount that is sort of proportional to their pain. So something that sort of takes the edge off and keeps the pain at a manageable level would be sort of what you're aiming for. And so provided that you're doing that your intention is to do that, even though it might be to continue to give someone pain medicine may actually bring about their death quicker than it would have otherwise, you can still give them pain medicine. Okay. And again, so the assumption is that you're giving it strictly to control pain, and that you're not actually trying to hasten death, right? And this tends to be one of the places where, again, in my own experiences, where you have to check. You have to really check how much pain medicine is being given, because very often, as time goes on, especially when, and we'll talk more about this in a few minutes, when the person has been deprived of nutrition and hydration, which is extremely painful, the way they normally treat that is to give them more pain medicine. And so I would say the first thing you always need to check, in the situation when you're making a decision, is how much pain medicine is being given. And again, this can go for the same thing with like principle double effect. Also, a lot of people, as they're dying, don't want so much pain medicine that it renders them unconscious, right? They want to be able to talk to their family. And again, that's morally illicit. But even knowing that, if you're like their healthcare proxy, if you know that's what they want, then you need to respect that, and limit the amount of pain medicine you're giving them. Yeah, I mean, assuming you're their proxy and you know that's what they want, then you would respect that. You would respect that. Yeah, so it's not upon us to decide if someone should suffer, right? Like, they have to decide that on their own, right? So the assumption here is that the person wants the pain medicine, right? Or the person who is responsible for making the decision wants the pain, like making this. But um, I mean, we do this all the time, right? Like in any aspects of life, if you see someone suffering, you should do everything you can to alleviate that suffering. But if the person goes, no, no, I want to suffer, you should then let them suffer, right? Yeah, I mean, I think as long as their mental faculties are sort of intact, you would still respect that, right? You're not doing anything morally wrong by allowing them to suffer when they're choosing it. What did you ask me? Yeah. Well, I mean, it would go both ways. Like, you can't necessarily force someone who's in a sound mind to even get medical treatment, right? Like, you can encourage them. Um, and again, this is sort of talking about end of life specifically, but even, uh, you know, uh, someone who is sick, and you assume they're in the right mind, if they don't want to be treated, then that's on them, right? They're the ones who are deciding, um, that they don't want to take care of the good that is their health. Not easy to see, but suddenly jumping in and becoming their parent doesn't help, right? Um, are any questions uh, about painkillers specifically, or about the principle of double effect? Okay, so the question is about pushing back on the advanced directive. Let's come back to it because I have a whole section um, on that. Right, other questions? Okay, so now I want to sort of talk about um, treatments. And again, knowing um, that there are some sort of ambiguities around the word treatment, right? Uh, so often you'll see bioethicists make a distinction between care, which is sort of always what is up here ordinary means, and treatments, which can be, um, which in a certain sense can be optional. Okay, so either way, so so you'll see treatments being sort of categorized in a couple different ways. One of the ways is ordinary versus extraordinary. And so ordinary and extraordinary just refer to not the actual like medical procedure, but more to the moral quality of it. Um, so you'll see proportionate. You often see proportionate versus disproportionate. So ordinary means are just those things in which there's more benefits than burdens uh, to the patient and to others. And then extraordinary or disproportionate means that the benefits do not correspond to the burdens and treatment. We'll come back to this in a minute. But you'll often see these terms used without necessarily making the distinction that they actually refer to sort of the moral quality of them. Okay, so ordinary or proportionate are always mandatory. Okay. Uh, extraordinary or disproportionate are always optional. All right. And so that means that a lot of sort of the calculus involves measuring the benefits versus the burdens. Okay. Um, among the benefits, uh, again, you can't necessarily, we are not statistical beings, but certainly understanding the chance that the treatment will provide a benefit has to be factored in. The magnitude of the benefit, is it going to provide relatively large benefit to the patient, and is it futile? Okay, so is death imminent regardless of the treatment? All right, and then the burdens include things like side effects, the expense, which is a legitimate burden, interference with other duties, burdensome to others, and we'll talk about that in a minute. Is it experimental? Are you able to give informed consent? Is it likely to, abhorrence just means, is it likely to somehow either disfigure me or sort of change the way my body works? And then there's obviously treatments that are immoral. Okay, so some examples will sort of help us to see this. Okay, and so this was an example with my mom. My mom was found at her house, unconscious, barely breathing. So the ambulance came, took her to the hospital, intubated her. She was, which is a breathing tube for all intents and purposes. She was not able to breathe on her own. And then by the third day, she was able to breathe on her own again. So they took it out. And after 2 more days, she again couldn't breathe on her own. So the question became, could we intubate her again? And so we had to do sort of this benefits versus burdens. The realistic part is a person who's been intubated twice very often doesn't have loses sort of the ability to breathe on their own, just because the muscle damage to their lungs. So the chance of the benefit was rather low. It's not always that's the case. It might be that that they may be able to do something a little different. They may be able to make an incision that would help her to breathe by putting a tube directly in. So all of these things, she had a ton of other things wrong with her. And so we decided that rather than intubate her a second time, we would let her die. And my conscience is clean. I think we went through this correctly. But the point was, if she had been younger and didn't have all of those other sort of complicating factors, it would have changed it, right? Because her chance of recovery would have been better. It may have been a little more reasonable for her to have to carry around something that would help her breathe because she was younger and didn't have all those other sort of complications. So you sort of do this calculation, and when the burden tends to outweigh the benefit, then you remove whatever the treatment is. And this can happen in the midst of treatments too. So in other words, you could be giving someone chemotherapy, and it looked like the benefits were really good. It turns out actually, the side effects or it just didn't work as well, and so that continuing the treatment and sort of ruining what little time they have left, quality of life wise, that becomes a sort of where the burden outweighs the benefits. Part of the point of this is you really have to be able to learn how to make these decisions on the fly. right? So in other words, understanding the two columns is really helpful. But in circumstances, um, you have to weigh them usually pretty quickly, because decisions have to be made. Usually, uh, you know, there are sometimes life and death decisions, and so it's always a good idea to sort of be aware um, of the this sort of calculation. The other thing too, which I don't necessarily have a slide on, but is this idea of informed consent. Um, there, I mean, the church teaches, and this it ought to be sort of part of the Hippocratic oath, that that whenever you receive a treatment, not only do you give your consent, but it's an informed consent, which means you've actually explained to me uh, what it does, what the benefits are, uh, what what the possible side effects are. Um, and I would say that anyone who doesn't do that never accepts, like, this is just a bigger medical thing. Anyone who doesn't acknowledge side effects of something, for example, never take that treatment. Um, now it doesn't mean you don't go and do some research on your own, um, but uh, but without this sort of conversation of the benefits versus the side effects, you can't make a decision, right? And that's what it means by informed consent. So in other words, it's been explained to you, or the benefits versus the side effects. Um, any questions on that? Yeah, I would just say, like, would the benefits outweigh the burdens of that? Right. That's, I mean, really is all it comes down to, right? So that's why I don't like necessarily ordinary versus extraordinary, because that seems extraordinary, because it's like, holy cow, this person's like gonna like have this long, like, this breathing thing for the rest of their life. That's why I think I like the terms proportionate versus disproportionate. But in general, just the calculus is easy. It's just, okay, do the benefits outweigh the burdens? Um, and then sometimes it's not that clear, right? Like, because we can't control everything. Um, but to the best of your knowledge, do the benefits outweigh the burden? It's like the cancer yeah, I mean, yeah, I mean, I think, I mean, well, that's like that's funny you brought up the death penalty earlier, right? Like, that's St. Thomas's point about the death penalty, is like, if somebody's going to repent, there's nothing like facing death head on that's going to cause somebody to repent, right? Um, and he argues that, well, actually, if the person doesn't repent when they're facing death, they never were going to anyway. Um, Now, again, this is assuming, like, the person doesn't die instantly or something like that, um, but again, God knows what He's doing, right? And so, you know, overall, when we try to manipulate the circumstances to sort of give the person more time to repent, we're kind of usurping that part of Him, right? Because we just don't know, right? So we should just assume that, again, do the calculus of benefits versus burdens, um, and assume that God's working through that. Yeah. Yes. Yes. Yeah. A thing we could actually calculate. Right? Any other questions? Well, I mean, it could be, right? Like yeah. I mean, it's just again, like morally speaking, I mean, it would totally be circumstantial as to like um, the way. So let's just say they're like, yeah, I just want you to let me die because I don't think I could handle like 3 months of being sick every day from chemo. That's their decision, and that's not necessarily, maybe it's not the decision you would make, but I don't think that person is sort of in a situation where they've done anything morally wrong by deciding, right? Now, there are, again, it's so circumstantial, right? So what if that's like a young father um, who like, so their sort of state in life also factors into it. Um, but I mean, you do see the flip side of this where people, yeah, I mean, that's totally, yeah. So like, using my grandfather just as an example. So he fell and broke his hip, 101, got a hip replacement, 101, pretty tough guy. Um, uh, totally, like healed from that, was kind of walking around again, um, but got an infection in his foot. And, he went to a wound clinic, they treated it, they just couldn't get rid of it. He was on antibiotics, and it got to the point where they were going to have to amputate his foot, and he decided he did not want to live without being able to walk. It's 101, and totally morally justified to not want that level of treatment. And so he died like a week later from going septic. So um, that's totally circumstantial for somebody half his age. We would have been probably talking about a different sort of moral decision about, yeah, like a 50-year-old should probably have his foot amputated. Um, and again, anytime you have surgery at 101, there's a lot of complications anyway. Just a lot of those things are factored into it, right? So it is circumstantial. That's why you have to sort of like educate yourself as to what's going on. Yeah. Yeah. And usually, like, it's kind of weird, right? So, usually, as someone gets older, usually when they fall and break something, that's usually the beginning, sort of the beginning of the end, right? And for him, it wasn't, right? Like, um, so yeah, so often that's what happens, and it's just because there's, I mean, putting somebody under at that age, there's so many complications that can happen. Um, and so, yeah, there's nothing, the point is, there's nothing wrong with necessarily letting someone die, right? Like if they're choosing to forego treatment, um, and this tends to be uh, a situation in which when people don't really know what to do, they're just like, oh, we always err on the side of life. Um, but that isn't necessarily always a good idea. So discontinuing medical procedures that are burdensome, dangerous, extraordinary, or disproportionate, the expected outcome can be legitimate. It is the refusal of overzealous treatment. Here, one does not will to cause death. One's inability to impede it is merely accepted, because that's a really important. Um, we we cannot escape death forever. The decision should be made by the patient if he is competent and able, or if not, by those legally entitled to act for the patient, whose reasonable will and legitimate interests must always be respected. And again, emphasis on reasonable will and legitimate interests, and we'll talk about that in a few minutes.
One thing about ordinary care, did you say like stuff like food, water, shelter?
Yeah, so that's always, so you always, this is where you like the terms are important. So care, there's no such thing as extraordinary care, right? So just care is care, right? Like, but yeah, I would say it's care. Yeah, definitely. We're going to talk about that in a second, but when you're talking about treatment, that's something different, right? So actually, one of the CDF has actually answered this question about nutrition and hydration, and strangely enough, very often the answers that you get from CDF are kind of ambiguous, but this one is pretty clear about nutrition and hydration. Is the administration of food and water, whether by natural or artificial means, to a patient in a vegetative state, morally obligatory except when they cannot be assimilated by the patient's body or cannot be administered to the patient without causing significant physical discomfort? And they say yes, the administration of food and water, even by artificial means, is in principle an ordinary and proportionate means of preserving life. It is therefore obligatory to the extent to which, for as long as it is shown to accomplish its proper finality, which is the hydration and nourishment of the patient. In this way, suffering and death by starvation and dehydration are prevented. Okay. So here's my my distinction that I made of care versus treatment. Care is just routine attention given to a patient. Treatment is an attempt to cure or return to health or control a disease. Examples of care: bathing, changing their clothes, keeping them warm or dry, turning them to avoid bed sores or getting a special mattress, pain relief, and providing food and water.
I have a question about that.
Yes, ma'am.
So, for one,
It's directly behind me. No, you're fine.
So when my grandfather, he had Alzheimer's, and so it got to a point where like he struggled with like swallowing all that. Thankfully, that never really got to like a head for him. But what kind of ended up, he had a not just a do not resist state, but basically he never wanted to be fed by a feeding tube or anything like that. Now, especially when he drank what my grandmother did, was like she fed him water like by the spoon, which is like pretty like intense, whatever. But this is she took amazing care of him.
Yeah.
But that's what she did because part of the reason I think had to do with like also when you get Alzheimer's at some point, he was nearing death. His body just kind of started rejecting food, water, all of that. Like she attempted this until like basically his body just couldn't handle food or water. So like, is it wrong to ever put like a don't feed tube kind of thing, or is that like a part of the care?
Yeah, that's part of care. So
like that.
So you feed them, like you give them food until their body can't tolerate it anymore. So in other words, like at a certain point, right? Like maybe your kidneys shut down, or maybe they start aspirating it, so everything that goes into their stomach needs to throw back up. I mean, that would be when you would stop, not when they stop swallowing, because you can avoid the swallowing thing simply by putting a feeding tube in.
Just curious. That he never really wanted a feeding tube. I mean, like again, he was, but I always like for that was felt wrong to me personally. But that was like luckily, like I said, that never became an issue. His body started rejecting him before any of that happened. So I was kind of just wondering if like even if like you shouldn't like any of your medical documents.
No, I mean you definitely wouldn't want to put that in. You definitely shouldn't respect somebody that says that.
That's kind of like my question.
Yeah. So if you were in a decision making situation and you saw that the person had like a do not put a feeding tube in, you should just totally ignore it. Yeah. So food and water are normal care and obligatory as long as they provide benefits. Okay. So in other words, sort of a little bit of the benefits versus burdens. So when it gets to the point where the person's body is shut down enough that either it's not being absorbed, they're throwing it back up, or it can be, and you see this a lot, I think, with Alzheimer's patients, they constantly are agitated by the tube and they just keep pulling it out. That might be a situation where you might say, okay, it's time to remove that. But again, it would be totally circumstantial. That would be the sort of exception to the exception. That I would not say that's an absolute rule. So always, and it's a corporal work of mercy to give food to the hungry and water to the thirsty. Always presume that the person needs food and water until it's very clear that their body can no longer receive it. All right, any questions on that? So that's the second thing that you will tend to run into, very similar to my circumstance. With the question of like prolonging life, you're just prolonging the inevitable. Exact words that you'll hear them say. Okay, let's talk a little bit about organ donation and brain death. Okay, so remember, the human soul has three capacities, not three souls, but three capacities. What we would call the rational faculties, that our intellect and our will, our sensitive faculties. So, in other words, our ability to move around, our ability to feel things, or sense knowledge, all of those things, and then our vegetative capacities, which are essentially our capacities for nutrition, growth, etc. Okay, and so all of those capacities flow out of the human soul. Okay, and so part of the reason why I'm sort of giving you this seems like a tangent, but what is death? What is death? Yeah, so when the soul leaves the body. So is it possible for us to measure when death occurs? Okay. All right.
Some of those things don't okay.
The measuring
Okay.
physical, so there's not saying when it actually leaves.
Okay. So if that is true, then how can we legitimize organ donation? Wouldn't we be killing the person?
And
Yeah, but we'd need some way to measure if they're actually dead, though, right? Okay. All right. So yeah, so it does come down to brain function. So okay, so this is a little bit controversial. Yeah. So there are a lot of people who don't like what's called the brain death criteria. I will say, from my perspective, in principle, it checks out. But the question is whether the actual medical piece of it checks out. Okay, it seems to be, at least according to John Paul II, it seems to be that it does. So what this is called is a neurological criterion. So why I gave you all of that is because when we say the soul is in the body, what does that mean? Well, if I said an angel was in the room, what would that mean? Okay, so some way acting, right? Some way acting on it. So the soul is acting on the body. So when we say that the soul is in the body, we don't necessarily mean that it's like physically inside the body. So Alexis' point, but the fact that the soul is actively acting upon the body. Okay. And so how does the soul act upon the body? Does the soul move your finger?
your nerves move your finger.
Okay.
I guess like, okay, so I guess, are you trying to connect it all back to the brain, basically the idea?
Not, I mean,
Like,
indirectly, yes, but
yeah, because it's like, okay, yeah, your nerve moves your finger. How does your nerve fire through your spinal cord that leads up to the brainstem? So yeah, like your interaction with, I guess, the world and like your consciousness and like your, like, yeah, like I guess like the sensitive, the rationale, especially like that comes through like your ability to like have your brain function.
yeah. So the point is that in order for the body to be an integrative whole, right? So for the soul to be the form of the body, for it to be a human body that is integrated into one thing, the brain is the integrating principle of the body. Okay. And so what we can sort of do is measure or at least detect whether there is any vegetative activity, whether the brain is sufficiently organized such that vegetative activity is maintained. Okay. And the soul acts upon the body as long as it's an integrated whole. So, so whoever said I totally lost my train of thought. So the soul acts upon the body, not necessarily through the brain, but it's able to act upon the body when the body is an integrative whole. Okay, and so when the brain can no longer maintain vegetative capacity, then we can say that the soul has left the body. Okay, and this is the idea behind the brain death criteria. Yeah. Yeah, and I mean, I've had this discussion with some people would say, no, actually, you should wait. Like, that's where the Jewish idea of like they've been dead for 3 days kind of thing, like, because that's when decay starts. They would say you should do none of those things until you actually observe decay, which is fine in principle. That totally makes sense. But again, in principle, to me, this also makes sense. So metaphysically, I think that sort of form and matter distinction, I think, applies here. But again, ultimately it's up to sort of medicine to determine the clinical signs that this is no longer the case. Now, I could say that, if you're not comfortable with this, so if you're not comfortable with the neurological criteria, then that doesn't necessarily bind you to donating your organs. Okay, so there's not necessarily. I don't think this is a closed issue, even though John Paul II spoke about it. I don't think he was speaking authoritatively at all. But I do think, again, because he is the Pope, we should take what he said seriously. But I definitely think it's definitely an open question. And so if you were to choose not to donate your organs, if you were in, if you had died, again, totally legitimate. But the point is, the reason why the brain death criteria is used is because that's supposedly the way in which we can measure the fact that the soul can no longer act upon the body as an integrated whole. Does that make sense? So once the brain can no longer do any of the has any vegetative powers, which would include breathing, circulation, I guess in a certain respect, nutrition, and they do have a whole set of criteria that seems to be pretty stringent as far as how they test. So they can see parts in which the brain, I guess they look for swelling in the brain, which would show that the blood's no longer moving through it. And they can artificially keep the heart pumping long enough to get the organs out.
Pretty hard to actually get organ donations. Like, But to meet that criteria is very hard.
Yes.
It's incredibly hard. So when it does happen, it's kind of like a big thing. Yeah,
Yeah.
exactly. Yeah, like to hit that criteria is pretty hard. Like, yeah, that's like why like you get like really weird examples of things working out, but it's pretty hard to hit that criteria and like.
Yeah. So
Like, it's a really hard, like it's a really like hard rules for medicine, I would say, for it.
yeah. So I mean, just to be clear, either way, we're acting upon the assumption that the person is dead when we take their organs. We do not take organs out of, at least essential organs out of a live person, regardless of how close they are to death. Well, I mean, so there's a moral well, you would say more just in the like moral certainty that they're dead, right? Yeah, I didn't necessarily like go there, but I mean, we could talk about that, but I would say that I mean, the incorruption of the saints, like that's a gift of providence. You would think if God was going to do that, He would just make it so that you wouldn't factor that in and go, that guy was kind of holy. I bet he's going to be incorrupt. So let's not touch his organs. So yeah, I think there is nothing necessarily per se wrong with mutilating the body after death. The only thing that they ask is that whatever is sort of taken apart is put back together and like buried, like so the whole person is buried. So you'll see this often with like when people donate their bodies to science. You know, they have to account for like pretty much every piece of flesh, like who's ever working on them, and make sure it all stays together in some way so that the whole body's buried. It's not like they have to like, you know, if they remove skin, they got to tape it back on or something. But they, you know, in every reasonable way, the whole body is still buried, even if it's delayed. Yeah, yeah. Yeah. No, the person's buried when they're done. Well, I mean, they should be, and I think it's actually a law. Oh, I don't know, but I know now it is. Yeah, I mean, theoretically, when they're done with it, they should. Yeah. 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 Yeah, but in general, I'm pretty sure that that's the law. I'm gonna say. So it's like the Pharisees asking Jesus, whose wife is she? Um, Wait, why do you assume your heart is perfect? Maybe you'll get a new heart. I will give you a new heart. Yeah, so I would say just in general, like we don't necessarily know the continuity of like the resurrected body, right? So I mean, if you were buried, your heart would totally rot in the ground. Like, what does it mean to get your heart back? Certainly, you wouldn't get the same exact matter back because but somehow it would be your heart then. All right. Anything else on the organ donation versus brain death? No. So this is about as like this is pretty much the only one that like seems to be morally acceptable. And the people that tend to reject this would just say you can't do it because you can't actually measure death. which again, that would be a clinical thing, so it would be hard for me to argue. I don't necessarily have the expertise there to argue that. I just think metaphysically and logically, the principles check out, but it all hinges on, can you actually measure when death occurs? Related to this is what's called a perpetual vegetative state, or persistent vegetative state. This is a person who's not necessarily in a coma, but they don't have any awareness of their surroundings. This person is alive, and you would treat them just as you would anybody else who's alive. John Paul II sort of summarizing, the man, even if seriously ill, will always be a man and never a vegetable or an animal. The right of the sick person, even one in a vegetative state, the basic health care, moral obligation to provide food and water to persons in vegetative state by even tube feeding, the need to resist making a person's life contingent on its quality, and the principle of solidarity to support the families of a loved one stricken with this terrible condition. So I guess somewhat ironically, about the time John Paul II was dying, there was a woman in Florida, I think her name was Terry Schiavo, who was in a persistent in a PVS, and her family actually pulled the plug, which kind of threw up a total uproar, because essentially that's murder, to cease to feed someone, and to continue to discontinue healthcare because they're in this persistent vegetative state. Yeah, that you would that calculation would come in, the burden versus the benefit would come into any treatment you were giving that person. So like ordinary care, you would still give them ordinary care, but you might say, okay, I'm actually not going to give them any medical treatment, because the chance for any benefit to them is so nil, right? Because they have, severe brain damage or something. You would stay there for a long time, yes. Yeah, I mean, so that still wouldn't necessarily. I mean, that's a legitimate burden, but you still can't remove food and water from them. I mean, you'd have to figure something out. Right? You'd have to figure something out. Now, perhaps you could just say, or perhaps like, yeah. I mean, I don't know what I would do in that situation, but I would not be the one who would discontinue food and water for them. I mean, you might have to figure out other ways. Yeah.
I don't know how listen to the church, but
He's already thought this through. Okay. I mean, so there could be, I mean, legitimately, right? Like, suppose the hospital like evicts you, right? You still have the obligation to feed them, but you may not be able to on your own feed them with a feeding tube, right? That's the circumstance. But that's not because you chose not to feed them. That's just, I don't have access to a feeding tube, and I can't continue to put, although again, that's assuming that's it. Like, feeding tube and hydration are pretty minimally invasive, and you have to be really bad off for that not to be able to be done at home, right? Yeah, legitimately, yeah, it wouldn't be stealing, but yes. Yeah. And only the amount you need at the time. You couldn't take it for like the next day or something. Okay. I don't know, maybe. It's totally, I'd have to really think about that. Yeah. My understanding is you're not allowed. They're not allowed to throw someone out like that. Yeah. 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 All right. So that's okay. So Devron brought this up, the advanced directives. Everyone know what an advanced directive is? Okay, so advanced directive essentially is to try to give criteria by which you'll be treated in certain circumstances ahead of time, right? And usually it's something in the effect, in the event that I'm incapacitated, uh, I do not want a breathing tube, or something to like Megan's example, like in the event that I am incapacitated, I do not want a feeding tube, right? So a lot of people do this. What I want to do first is use an example of a friend of mine uses to show just how absurd this is. So he has what's called the vocational advance directive. And what he's trying to show is like you can't possibly know all the circumstances of what's going on. So he says, in the event that I have been in a relationship with a good Catholic girl for 6 months, I direct that this shall happen. I shall either propose marriage or break up. So irrespective of the circumstances, um, you choose to do this thing, okay? And then section B, in the event that I'm on a vocation retreat and I have a feeling of peace, I direct that I shall apply to my diocese formation program, apply to become a Cistercian monk. I put that one in there for a certain guy in here, or immediately propose marriage to the girl in section A. Okay, so Nicholas maybe had a vocation retreat with a feeling of peace, and he had promised, he had signed his vocational advance directive many years before, and so now that must happen. Okay, so the point is, to be serious, you will see what's called a living will or an advance directive. If I'm in the final stages of a terminal condition and my death is imminent, I direct my attending physician to withhold all artificial life-sustaining procedures so that I might die a natural death. Okay. Now, on the surface, that seems great, right? Except there is so much ambiguity in there, and so much legal language, and it's so open to interpretation that you will never know whether the right thing is going to be done or not. Okay, so for example, suppose this person is in the final stages of a terminal condition, and they really like dum dum lollipops, and they accidentally choke on a stick. They would say, "Don't do anything; just let me choke to death." Okay, so a perfectly reasonable thing to do would do the Heimlich maneuver and save the person. They go on living. Well, it is artificial, right? Like artificial just means man-made, right? Like, yeah, like just any kind of intervention, right? Yeah, yeah, yeah. Again, really ambiguous, right? Death is imminent. What does that mean? Uh, what does terminal condition mean? Diabetes is a terminal condition. You'll die with it. Um, what is artificial? What's an artificial life-sustaining procedure? Is the Heimlich maneuver one? Is I don't know, continuing the medicine for diabetes, is that artificial? Who is the attending physician? Most situations there is not one physician who gets to decide. So in general, these are bad ideas, right? And I probably can't emphasize that enough. They are terrible ideas. Okay. Same thing, but to a sort of a lesser degree, of DNR and DNI. So DNR, do not resuscitate. DNI is do not intubate. Yeah. So you should. I mean, now I did say that, in most circumstances, if someone is in the end stage, legitimately in the end stage, and they decide that they do not want to be resuscitated, that's perfectly fine. Or again, it has to be circumstantial, but you can't decide that years in advance. You can certainly decide it in your closing days. Yes.
Okay, the only question I have is, so Homer has like Alzheimer's.
Mhm.
This discussion like all happened. It's like they've had some time going to like so that because the way Alzheimer's works, you kind of can plan ahead for the time to a certain extent. But like you also have to kind of like what you're talking about with those, it's like you have to kind of be careful with that. So I think what they did was they took the DNR away, but like they had like he basically woke her before like he lost himself. That like once he got to that stage of losing himself, that like he did not want to be resuscitated.
Okay.
Is that like fair because of like
Yeah. So the difference, though, right, is he told her that, and she could make the decision in the moment.
Okay, so that's better than like
Yeah.
someone has that.
Yeah. So using my mom as an example, right? Like on closing days, if she had a heart attack, I told them not to resuscitate her.
Okay.
Right. But she didn't necessarily have a DNR.
Okay, because I know, like I said, at one point he had a DNR, but I think that
Yeah.
had been talked out.
Yeah. Yeah. So this healthcare proxy, which is what everyone's talking about, is the key to all of this. Okay. Under North Carolina law, an advanced medical directive serves the same or similar function as other documents called a healthcare power of attorney, healthcare proxy, or living will. Also be aware that if you do not complete and sign an advanced directive medical form, and if the attending physician determines to a high degree of medical certainty that you lack capacity to make or communicate healthcare decisions, and you will never again, you'll never regain the capacity, the physician or others, such as guardian or spouse, may decide to withhold or discontinue life-prolonging measures. Therefore, signing an advanced medical directive is vitally important to ensure your wishes are carried out. So one of the things that that's recommended is that you pick someone who will make the decisions for you. Okay. Now, very often this would just be your spouse, right? But there's a lot of cases where spouses are not on the same page. No, like there are several people in my life who I am their healthcare proxy. And so somewhere in their will, I wish they would put where they were giving me money, but somewhere in their will, they're like, if I'm incapacitated, please contact Rob Agnelli, and he will make decisions. Yeah, yeah. Please pay for his Starbucks. Sits at my bedside. So here are the recommendations. Appoint someone who has the strength of character to make good judgments in difficult circumstances, and you can trust to make decisions on the basis of church teaching. That's sort of obvious. No one should agree to act as an agent for someone if that person would expect them to act in a way that disregards church teaching. Okay, so the whole thing about respecting someone's wishes, do not do that. Like, always do what's right. And then in the places where you can respect their wishes, you should. So the primary thing is doing what's right. And secondary is to then do what they want. Okay. And again, all of what I said earlier, serving sort of as a caveat as to, if you know the person would look upon, certain things as more burdensome than you would, you should make the decision as if they were. Appoint someone who is likely to care for you in the distant future. Discuss the specifics of your directives with the person and review these periodically. Include a provision which treats the situation when death is imminent and allows them to act based on benefits burden criteria. Okay, so you want to give the person the freedom to make the calculation for you. Again, all of this is based on whether you trust, fully trust the person to make the moral decision, and then to also do what you would want to be done. Secondly. Yes. All right. Any questions? Yeah.